Welcome to the deep dive. Today we're looking into a really vital profession, but one you might not hear about much, UK clinical coding.
That's right.
We've gathered insights from, well, a pretty thorough market analysis looking at careers and, importantly, the money side of things, especially after you get the National Clinical Coding Qualification, the NCCQ. Our aim here is to give you a quick shortcut, really, to understanding what looks like a dynamic and, frankly, financially rewarding path. So, okay, let's unpack this a bit.
Yeah, and what's really interesting, I think, is seeing how the role itself has changed. I mean, it used to be quite a scattered admin function, didn't it?
Definitely.
But now it's really become this structured, recognized allied health profession. And right at the heart of that shift is the NCCQ.
Okay.
It was set up back in 1999 by NHS Connecting for Health and IHRIM. It's basically the benchmark, the only national qualification for coders in the UK.
And it came about because the NHS really needed, well, better data, didn't they?
Yeah.
High quality, consistent information. You had things like information for health, the NHS plan. This data fuels everything. How hospitals get paid, that payment by results system.
Crucial for that.
Healthcare planning, research, all of it. But it was also explicitly about giving the profession recognition and creating a proper career path where there wasn't really one before.
Precisely. A solid foundation. And, for anyone listening who's maybe less familiar, it's like creating a standard language for describing patient care.
Yeah.
But this qualification, it's not easy. It's rigorous.
Which makes you ask, okay, what's actually in this gold standard exam?
Good question. Because this is where you see just how much precision is needed. The NCCQ exam is a whole day thing, 2 papers. The practical one tests your skill in assigning the codes ICD-10 and OPCS-4 straight from patient notes, diagnoses and procedures.
The core classifications.
Right. And get this, the pass mark is 90%. An incredibly high bar.
90, yeah. It just shows how critical accuracy is. Get it wrong, and there are big financial hits or even clinical governance issues for the hospital trust.
Absolutely. Then there's the theory paper. They actually upped the pass mark for that recently to 70%.
Oh, really? Okay.
And that tests your understanding of, well, medical terminology, anatomy, data quality rules, and SNOME-CT.
Ah, SNOME-CT. That's the really detailed one, isn't it? For the electronic records?
Exactly. It's not just classifying what happened, like ICD or OPCS. It's the whole rich vocabulary, symptoms, findings, everything. It's about really understanding the modern digital healthcare language.
So it's comprehensive, which leads to the big question. Why is getting this qualification such a career changer?
Well, that's the key, isn't it?
Because it really acts as a catalyst.
Yeah.
We hear that for a lot of people, passing the NCCQ means like an instant promotion.
That's often the case, yeah.
Under the NHS pay system, the Agenda for Change or AFC framework, you might start as a trainee, say band 3 or 4, maybe earning, what, mid-20s?
Around $24K to £30 roughly.
Right. Then you qualify, become an accredited clinical coder in ACC, and boom, you jump to band 5.
Which takes you into the $31K to $37K bracket, roughly. A noticeable jump.
Definitely. And it's not just that first step. It's the absolute requirement, the gateway for all the more senior roles. Things like lead coder roles, managing complex cases, maybe team leaders, managers running the department.
Bands 6, 7. So you're looking at salaries moving up towards, say, $38K, $46K, even into the $50K plus range for managers.
Yeah, or specialist roles like auditors, trainers. They can go even higher, band 7, 8A maybe. So 47K, 60K plus.
It shows a really clear structure for moving up within the NHS, which isn't always common.
True.
But here's the interesting thing. The NCCQ doesn't just open that NHS door. It actually unlocks sort of 2 quite different financial routes.
Okay, and this is where the money side gets, well, quite different depending on your choices. The NHS gives you that structure, the predictable salary bands.
The stability, the benefits.
Exactly. But then there's this growing contract market.
Yeah.
And the income potential there can be significantly higher gross income anyway.
We're talking daily rates. Yeah.
Yeah. Experienced ACC contractors, you might typically see rates of, say, 220 to 250 pounds a day, sometimes quite a bit more, 300 pounds, maybe even 350 pounds.
Wow. So if you annualize that,
you're easily looking at 57,500 pounds up to 80,500 pounds or even more. That outstrips quite a few senior NHS bandings.
Definitely. But you're giving up the NHS perks, right? The pensions, sick pay, that security blanket.
Absolutely. It's a trade-off.
Yeah.
What's changed things recently, though, is the whole remote working shift.
Ah, yes, the remote revolution.
It's made NHS coding, and therefore contracting too, much more flexible. Lots of trusts offer remote or hybrid options now.
which creates this real duality, the strategic choice for coders. There are some permanent roles in the private sector, quite niche, but it's really the contract market, mostly driven by NHS need, that shows just how valuable this skill set is on the open market.
It's like choosing the steady path versus the potentially more lucrative but less secure adventure trail.
A good analogy. Which brings us to the practical point.
Okay.
What's the best long-term play for your career?
So pulling this all together, what's the bottom line for you, the listener? The NCCQ, it seems, is pretty much the single biggest milestone in a UK clinical coder's career.
It really is.
It's your passport, either to the stability and structure of the NHS or to the more flexible, independent, and potentially higher-earning contract world.
And often the smartest strategy seems to be a bit of a mix, a hybrid approach.
How so?
Well, maybe start in the NHS. Use their funded training, that's a huge plus, get the NCCQ, then really dig in and build solid experience. Work across different hospital specialties for, say, 3 to 5 years after qualifying.
Build that professional capital.
Exactly. Get really good, build your network. Then you're in a strong position. You can choose to make the leap into contracting, leveraging that expertise to maximize your income.
So you get the best of both worlds, potentially. Security and training first, then higher earnings later.
It's about crafting a career that's resilient, adaptable, and fits what you want financially and professionally.
A really interesting and quite empowering career path. So for you listening, maybe the question is, what mix of security benefits and income works best for you? How would you use that NCCQ qualification as your strategic tool to build the career structure you want?